I love it. Very cool. Let's see what we're doing here. We're gonna wait one more minute. Appreciate everyone for being patient on there. Well, now I know it's not even like everyone's Saturday morning. I don't even know. I don't know what what time and where it is. Laura, LA. Hey, Laura. All right. And let's see, what else do we need to do before we get going here? Yeah, my videos are queued. All right, cool. Okay, all right, Rancho Cucamonga, Mirella. All right, cool. Okay, so everyone can hear me, right? We're good? All right, so my name is Dr. Santo Riva. I'm a physical therapist, and I own Victory Performance and Physical Therapy in Culver City, California. I'll tell you a little bit more about me. I grew up here in Los Angeles, in West Los Angeles, and I didn't go too far away from my undergrad. I went to UC Santa Barbara. I had a lot of fun there, and truthfully didn't study anything that made too much of an impact in the world. But I did find actually later, and we'll get to that my studies in sociology really have helped me a lot as I've run this business and as I've learned to really understand our clients and our patients better. But I went to UC Santa Barbara. I got a degree in sociology and I got a minor in personal fitness with a personal training emphasis. I worked as a personal trainer for a long time with helping people lose weight and sports and performance goals. I was pushed by my father over and over again that I should go back to school and get a higher level degree. And so I did. But before I figured out what that was going to be, I knew that I really enjoyed the health and fitness world because of the relationships that I got to build with people. And I never had physical therapy before. And so I was like looking at different like physiology degrees and different things. And I came across physical therapy and realized like this was the perfect role for me, where I got to really understand and learn about how the human body worked and functioned at such a higher level. And I still got to work with people, which was really important to me. And I loved that idea of being able to work with people and get to know them and understand how like psychology played a role in helping them achieve goals. So fast forward a couple years, I had to do all my science classes because I like literally took no science classes in undergrad, which is why I was able to have so much fun. But I did 2 years of like prerequisite science labs before applying to USC to get my doctorate in physical therapy. I went to USC, I got my doctorate. That's a 3-year program on top of my degree grad, on top of the 2 years of science prereqs. And then I stayed at USC doing a postdoctorate residency in orthopedics. Orthopedics is bone, muscle, like that sort of stuff. So I specialized in that. While I was doing that at USC, I was also teaching in their doctorate program and working at a clinic, at their clinic, where I got advanced studies in the management of orthopedic disorders. I am a board certified orthopedic specialist. And after I did all of the schooling, I went and I worked at a clinic down the street from here for 2.5 years. I learned a lot. I saw a ton of patients, which was a good thing. The bad thing was I saw a ton of patients, which is sort of standard here. I don't know if in New Zealand what that's like, but definitely here in an insurance-based model, for the most part, it's get as many people in through the door as you can. Because the insurance companies don't pay shit, truthfully. So it was total burnout, and I went from like this, I want to be the best for my patients, to being like, okay, now I just need to be really good at managing an handleable amount of patients at one time, because there's no time to like get to know people. Like I'm seeing 3 patients an hour, like it's just churn them and burn them type of thing. And, you know, while I'm here trying to have a conversation with someone on the table, I'm yelling at my aides across the room to, you know, do this exercise and that exercise. And skilled it was not, and it was a total burnout. So I decided, I'm going to open my own thing, and I had no idea about anything that had to do with business or what the heck I was doing. But here I am now, 6 years later. I stopped working, and I was like, okay, I'm about to have a kid. I'm going to start my own business. I don't know what the fuck I was thinking, but I did it, and I'm here, and I'm very happy that I get to do this now, and we've grown to a staff of 5 people, where I get to dictate what this is going to look like, and I really can build a business that's all about my client and helping them at a level where you can't get it. I'm not trying to brag or anything, but the truth of the matter is that when you're seeing 3 people, an hour, number one, your provider's burnt out. Number 2, they're not able to give you the type of attention that you need to actually really get to know you. And you're not a diagnosis. You're not what the x-ray says. You're not what the doctor says. Everybody is different, and they need to be treated differently. And expectations need to be set for, the end user, for our client, to get the results that they're looking for, or they stop. And we'll talk about this and how this all plays into why physical therapy may or may not have worked for you in the past. Or talking about some of the hesitancy of why you may not want to actually go and see a provider for this because you think it's going to be bullshit, which it very well might be, and a waste of time. So anyway, so that's a little bit about me and why I'm here. I've seen lots of shoulders, and I think that I've got some good information for you. I'm going to tell you a little bit about what we are going to talk about here and what this workshop is for. And I have to write some of this down because I want to make sure I don't miss anything here. Okay, so we'll be done this workshop by 2 o'clock, so under an hour. So what this workshop is free, right? But there's not going to be anything magic in here that's going to get you out of pain. I'm not going to be giving you random exercises that you can do on your own. So if you think that if at the end of this you're going to be cured and solved, I'll put that out there right now. I don't want to waste your time, and I don't want you to be upset at the end of this that I thought I was getting this. So that's what that is. I will tell you that there is going to be an offer, and I'll put the offer out there right now, because sometimes people don't stay till the end. But if you are interested in a one-on-one evaluation, and we're doing these online, or you can come in person if you're here in the area, I will take $100 off of that first evaluation price. Eric is going to put in the chat the link. So if you want to click on that link and put that you're interested in it, we'll reach out to you, and we'll talk to you about really getting a start on a solution to the problem that goes deeper than what we're going to be able to talk about today. And there's also an offer for, if you're not ready and you still just want to see if this is the right fit, for a 30-minute totally complimentary consultation. Eric will put that in the chat right now. And if you just put your info in the landing page, we'll get back to you, and we'll set something up. Okay. So yeah, here's the other big thing. So after working with I've worked with a ton of shoulder patients, and I'll tell you that if you're going about this the Dr. Google way, you're going to end up wasting time and having a lot of frustration. I've done this, and I still do this. I don't know why, but I always think that I could DIY stuff at my home, and I fuck it up, and I make it worse than it was in the first place, and I end up wasting all types of time and going to Home Depot 12 times and buying things and returning things, or not even returning them, and then I end up calling somebody to come and fix it. It's the same thing with shoulder injuries. From what I see, the shoulder is super complex, and here's what we're going to talk a lot about the biomechanics, about the anatomy, about different diagnoses that people have, and why this do-it-yourself rotator cuff exercises from Google, it's not going to cut it for you in, we'll say, 95 out of 100 times. Okay. Last thing is, we do rely on word of mouth marketing to value what you found here today. Tell a friend, spread the word over social. We're at Victory Performance PT. Okay. So shoulder pain and just pain and injury in general. Why does it happen? Okay. So put simply, it is when the load to the tissue exceeds that tissue's capacity. There's a couple ways that people could end up with an injury. It could be trauma. So you could fall on your shoulder. You could have a car accident and the steering wheel jams you. Could be surgery. Surgery is a traumatic event. Don't kid yourself. Surgery is traumatic, right? It could be a sports injury. You're lifting weights and all of a sudden you feel a pop. Or it could be an overuse injury. So that would be like a tendinitis or tendinopathy. And basically what overuse injuries are, or what it means, is that there's been an inadequate amount of recovery time. Okay. So just to like simplify it, like when you work out, when you're lifting weights, you are causing damage to the muscle. But then when you rest, you recover, your body builds up stronger. But if all you're doing is breaking it down, so if I do, arm day every single day and I'm just breaking it down, you typically are going to end up with an overuse injury in the form of a tendinopathy or a tendinitis. Okay, so I'm going to talk about some of the diagnoses first, just real quickly. I'm going to list them, and you might hear what you think you have or what you've self-diagnosed, or the diagnosis that you've been given by the doctor. I'm not going into them right now. I will go into them at the end, but I want to put them all in here. And if you don't hear the diagnosis, just put it in the chat, and I'll make sure that I talk about it. Okay, so different diagnoses. You could have a rotator cuff tear. You could have impingement, tendinopathy or tendinitis or tendinosis, a muscle strain. You could have a tendon sprain. You could have referred pain from the spine or from a nerve. You could have frozen shoulder, also called adhesive capsulitis. You could have bursitis. You could have avascular necrosis. That's like the bone is dead. You could have a labral tear, dislocated humerus, osteoarthritis, rheumatoid arthritis, thoracic outlet syndrome, or a brachial plexus injury. Those are the most common ones that can contribute to shoulder pain. Okay, so shoulder anatomy. Your shoulder is a ball and socket joint. So you've got the ball. That ball is this part, and the socket would be this part here. So you've got a ball and a socket. But actually, there's more to it than just a ball and socket joint, because your shoulder is made up of 4 unique joints. So not just a ball and socket joint. But just, I'm going to come back to the other 3. But when we talk about the ball and socket, which is that glenohumeral joint, now the only other place that you have a ball and socket joint like your shoulder is your hip. Your hip, as you've noticed, does not move like your shoulder. Your shoulder, you can move all over the place, behind you, over here. It's really amazing how much motion we have. And the reason that this ball and socket joint is able to do that is not just because it's really complicated, but the actual socket is smaller than the hip socket. The hip socket is going to cover more. And with the shoulder, we've got a smaller socket, which allows for more motion here. That's simply put, but just so you understand that. So it's more akin to a golf ball on a tee, right? Like a tee doesn't cover the whole golf ball because you need to be able to whack it. So it's like a tee and a golf ball sitting on it, so that you have a lot of degrees of freedom. Okay, now the shoulder, 4 joints. We just talked about the glenohumeral joint. Now the glenohumeral joint moves in a lot of different directions. This is flexion, this is extension. This is external rotation. This would be internal rotation. This is horizontal abduction, and then we also have abduction, and adduction is coming back this way. Lots of movement at the glenohumeral joint, that ball and socket joint. Now the other joints that we have the sternoclavicular joint, which is right here. It attaches your sternum to your clavicle. You've got your acromioclavicular joint, which is here. It's your clavicle and your acromion, which is part of your scapula. So both the sternoclavicular and the acromioclavicular, the movements that they have are elevation, right? They can go up, they can go down, and then they can also rotate a little bit, but there's not a lot of rotation there. And then you have your Scapular Thoracic joint, which is a very unique joint because the scapula, so Scapular Thoracic, you've got your scapula or your shoulder blade. It moves along the rib cage. So it's a floating joint. There's not a true joint there. Like you can see here, okay, I've got 2 bones here that are attaching and they move. Now, the scapula just floats on that rib cage, right? So here, oh, thank you, Eric's fixing it so you can still see me. Okay, so you've got these 4 different joints, right? And now to make things more complicated, you've got lots of muscles. Now you have 17 different muscles that just attach to the scapula. You have 8 muscles that attach to the proximal humerus. So right here, you've got 5 muscles that attach to the clavicle. Plus, when we're talking about shoulder motion, plus there's all of the muscles that attach to the rib cage and the spine and everything else. So all of these things play into how your shoulder is going to move. Now, we also have nerves. Nerves can, nerves, you got to have your nerves moving to, or working to make your arm move, right? Now, your brachial plexus, which supplies, it supplies the innervation, which means it makes it move, but it also deals with sensation of that area. When we're talking about pain, that's a sensation that your brain is processing, is made up of nerves that come from T5 to T1. So they come out of your spine in your neck all the way, so from the middle of your cervical spine to your upper thoracic. And like roots of a tree, they come together and then they're going to split again to go and innervate all of the different muscles. So all of those muscles need to have a nerve going to it, and those nerves need to function properly. Other tissues that are part of your shoulder we'll talk about are the labrum. Now, I talked to you about that T and the golf ball. Now, what's different between a hip joint and a shoulder joint is that there is cartilaginous tissue on that T called your labrum that helps keep your shoulder in place. So it gives it like a little bit more of a cupping action to allow for more stability of the humerus in the glenoid. And on your hip, you do have a labrum, but it's not quite as big. So, so you've got your labrum that can be torn. You've got your bursa. So that's just, your bursa makes it so that there's like cushion for where the muscles and the tendons go over bones. You've got the ligaments that connect bones to bones, and you have tendons that attach muscles to bones. Now, all of these things that I just mentioned can be the source of pain. So they can be the source of the pain, right? So I can tear something in my deltoid and I have pain there from where that tear is. The thing that is super important when we actually want to get to the root cause and solve the problem is that the source of the pain is not the same thing as the cause of the pain. So the source does not equal the cause. And so if your treatment is just targeting that source, so for example, I'm going to give you a cortisone injection in that tendon because your tendon hurts, right? Okay, great. Now the cortisone wears off and you're in pain again. It's because you haven't actually fixed the source of, you haven't actually fixed the cause of the pain. You've done something at the source, but the cause is still the problem. And I'm going to talk about that a little bit more and how this all ties together, and also why sometimes rehab doesn't work, or going to the doctor doesn't work, or getting shoulder surgery doesn't work. All right, so I'm going to go over some biomechanics of the shoulder joint, and I think this is the time where I was going to play the video. So give me like 3 seconds for me to figure out how I'm going to share my screen here. I got the video playing. This is a video of abduction. Boom. Can I do this? Am I allowed? Hey, Eric, can you let me share my screen? We gotta ask Dad here to let me share my screen. Okay, I'm a co-host. I'm gonna share that. Thank you. Boom. All right. Can you guys see that? Can you give me a thumbs up if you can see the video going? Cool. So this is shoulder abduction. You can see the scapula moving here. I don't know, I think you can see. Can you see my mouse here? Yeah, okay. So here's the scapula. Here's the glenohumeral joint. Here is your your SC joint, sternoclavicular, and you can't see the AC joint here, but it's right here. This also doesn't have all of the muscles in it, but you can see that there is a lot going on with that shoulder movement. Okay. Now here's shoulder flexion. Same deal here. You can see that there's a lot of moving pieces involved with getting you to be able to lift your arm, right? And to be able to do the things that you want your arm to do. So, and, you know, if you're dealing with shoulder pain right now, like, it's one of the things that makes you realize like how amazing the shoulder is and how much you use it for like pretty much everything in life. Very complicated joint, but also that's why it's so amazing and allows us to do so much cool stuff. All right. Okay. So I'm going to talk to you again about the different diagnoses, and I'm going to go into a little bit more detail about what they mean, and more specifically what they mean when we see them in here, and maybe some of the things that we would look for when these happen. Okay, so rotator cuff tear, I feel like that's one of the most common things that we see here with people coming in with. Now, a lot of times people actually have rotator cuff tears and they don't have pain, or they've had a rotator cuff tear for a long time. All this is to say that sometimes the source of your pain is not what the image might show. So you've got an MRI, it says you have a rotator cuff tear, but we know there's a lot of people that have rotator cuff tears that don't have pain. So it's not always so simple as like, okay, well, you know, my doc says I'm going to need surgery because I've got this tear, so I'm going to go, you know, they're going to go in there and fix it. The thing that is not thought about or maybe not discussed is that after you've had that surgery, now you're going to go and, you know, really put your time and energy into doing the rehab. You're going to actually give yourself a break because you've had a new traumatic event, right? So like after you've had shoulder surgery, you're not going and like trying to bang out push-ups or something like that. Like you're going to rest it. So hard to say, truthfully, like if you haven't really given physical therapy a shot, and real physical therapy where they're going to, you know, not mess something up. We'll talk about that. Then, you know, hard to say if these surgeries are actually more beneficial. And they've done lots of long-term studies where they see that a year out, there's no difference or minimal difference. And this is not the case for all of them. And so I'm not, you know, I'm not saying that all surgical cases or whatever shouldn't happen, but it happens. So it's good to have this in your mind. But they've looked at it in a year, and there's not a big difference between people that went a conservative route and people that have had the surgery. So is it the surgery that fixed it, or did the surgery just make it different? And what really helped it was the rest and actually doing a rehab program. Or is it they've had surgery and now they've actually stopped doing the things, or stopped having the thought in their head that they want to get back to doing the things that, you know, made them frustrated about having the pain in the first place. And unfortunately, that happens a lot of times too, where people just give up on doing the things that hurt in the first place, which is not what we want to have happen. Okay, so impingement. What impingement typically is that you're pinching your supraspinatus, which is one of the rotator cuff muscles, underneath that acromion. So your scapula is not moving correctly, and every time I go to lift the arm up, because the scapula is not rotating as much as it should, I end up banging the underside of the tendons, or the top of the tendons. Oh, whoops, hold on. I need to stop sharing. Oh, here I am. Okay, I'm back. Okay, so you end up banging the underside of the acromion with the top of the muscle, and that pinches, and that can cause pain. Again, that's a source of pain. It's not the cause of the pain, but it will be a source. The other thing that happens is tendinopathies. So tendinopathy tendinitis is another way of saying it. Those are typically overuse injuries. And overuse doesn't have to be that I worked out too hard and I didn't recover. It can be that that basically the mechanics of how you're doing something, some sort of repetitive task, are irritating to the joint. It could be that you don't have the proper stabilization here at the base of the shoulder through your core, so that as you're doing all of these repetitive motions, you are wearing on the tendon. There's more stress happening at the tendon than the tendon can tolerate, right? So we talked about injury. Injury happens when the load to a tissue exceeds that tissue's capacity to handle it. You could have a muscle strain, and that could be up, my baby is falling from a window and I go to catch him and I strain something, or I tear the muscle here because my tissues were not able to tolerate slowing that down. You could have a tendon sprain, right? So a muscle strain, a tendon sprain, that's a little different than a tendinitis, because a sprain would happen all at one time. Think of an ankle sprain. If you're rolling your ankle, that can happen at the shoulder as well. You could have referred pain from the spine. So those nerves that we talked about, the brachial plexus, how it comes down through here, it comes out of your neck, it's going to go underneath your clavicle, it travels through your armpit, down your arm, anywhere along here, or even here. Let's say you have a herniated disc in your neck, that will refer into your shoulder. You can have pain there in your shoulder, or even anywhere down your arm. Frozen shoulder, or adhesive capsulitis. This is seen more frequently in women between the ages of 40 to 60, but men do get it. And it often is preceded by some sort of an injury. It could be a rotator cuff injury. It could be a falling on your shoulder. But basically, something happens that starts this process of excess collagen being laid down in the joint, which will greatly affect your ability to move your shoulder. Okay, so that would be frozen shoulder adhesive capsulitis. Typically, those things take about a year to get better, and they're self-limiting. We'll see some people will go and get some sort of manipulation under anesthesia. That doesn't always help. Sometimes it does. It can be painful. There's different stages of it where it's more or less painful, and where you have more or less mobility. But typically it takes about a year to get better. You could have bursitis, and that's just irritation of that bursa that can happen from faulty mechanics of the shoulder. You could have avascular necrosis. So that's when the bone actually dies, and this can happen for a multitude of different reasons. It can be from some sort of traumatic injury, but the bone dies, everything hurts. It's just a very achy shoulder. Nothing seems to work. Labral tears. Labral tears happen a lot too. The source of the pain would be the labrum. So that's that area on top of the tee, right? We've got a tee and we've got the golf ball. That gives it that extra support. So those are seen a lot of times. We see them in like CrossFit athletes or people doing a lot of pull-ups, also in overhead throwing athletes. They'll have a lot of labral tears. Dislocated humerus. We saw a few of these this week, actually, from people skiing, having ski accidents. I stay the fuck away from the snow, because people come in here with like bad accidents from skiing. And I just don't want to have anything to do with it. No one comes in here with like, oh, I have like a sore hip from skiing over the weekend. It's like I broke my femur in 4 places. But anyways, more power to you if you like to ski. I'll see you soon. Osteoarthritis, that is when there's less space in the joint, or there's degeneration happening and you're just not getting like a nice smooth movement in that joint. That could be achy, usually when you start moving or warming up. Feels better. Rheumatoid arthritis. So this is a rheumatic disorder, and the rheumatoid arthritis will affect different joints differently, but that can definitely be a source. Now, thoracic outlet syndrome. This is a little more complicated one, and there's a true thoracic outlet syndrome, which has to do with blood supply to the nerve root. Getting pressed on, and so the nerve is not getting the blood supply. But it also, the syndrome part of it gives way to more of like this garbage bag terminology of like pain that sort of doesn't make sense, that goes down your arm. It's definitely more involved with the nerves and the nerve roots, but can cause like tingling in your pinky, or numbness into the hand, and the symptoms might change. You may have weakness, so you may actually see that like the tricep, there's atrophy there. and you like can't do a push-up anymore. We've got a brachial plexus injury, so that's sort of the same deal here, where there's some sort of a nerve irritation. And then the other one that I didn't put in here that I saw twice last year and hadn't seen it in my entire PT career before that is long thoracic nerve palsy. And what you see there is that the scapula just completely wings. So the innervation to the serratus anterior, which is one of these muscles, like there's something wrong with the wiring there, and the scapula is just completely winging off of the back because it's missing that muscle to hold it on the rib cage. So those are the main diagnoses. Let me see, does anybody have anything or want to put something in the chat that I didn't talk about here in terms of a diagnosis or something they were giving a diagnosis of? Wait here for a second. Anything? No, okay. All right, I think I hit them all. Oh, I still have not been given a diagnosis. Okay, well, did anything that I say sound like what's going on with you? Probably, possibly. All right, okay. So we talked about the diagnoses, and again, those really talk more about the source of the pain, right? I have a rotator cuff tear. It's a tear of the rotator cuff muscle. I have a labral tear. It's a tear of the labrum. Those are the sources, but what I know is that the screaming victim is not the silent culprit. And so we've talked about the anatomy, we talked about the biomechanics, we talked about the diagnoses. Oftentimes, the place that hurts is the screaming victim, and the silent culprit is that thing that's contributing to the pain or to the tear or to the tendonitis. I'm going to give you an example of this situation. So oftentimes, like here, we see overhead athletes that come in with impingement and or tendon tears, rotator cuff tears, usually supraspinatus, which is the one on the top that comes along here. That's the most common one that's torn or worn out. Now, there's a lot of reasons why that source of pain could have happened or why that tear could have happened. One of them is that they may already have a loose shoulder and there's just more jingling in there. Like maybe they've had a labral tear in the past that didn't give them much pain. Maybe they're just more flexible and they've got more wiggle room in their joint. Maybe they don't have enough thoracic extension. So we talked about the Scapular Thoracic Joint. What I didn't say was that for someone to be able to get full overhead motion, the last 15 degrees of that overhead motion actually comes from your thoracic spine extending and your scapula, your shoulder blade being able to tilt back. That's that last 15 degrees. So, okay, they have a problem with their shoulder, but the actual problem is the scapulo-thoracic joint, or more specifically, the thorax or your thoracic spine, which has to do with now, okay, you've got your rib cage attached to your spine, right? You've got your sternum, you've got all of these muscles through here. That's a problem that's farther away from where the source is. It could be that the person didn't have had inadequate strength to do the activity that they were doing, right? So they just didn't have the strength to do as many pull-ups as they did. And so they ended up wearing down an area, an area of their shoulder. They ended up tearing something. The other thing could be that they had the strength, they had the mobility, but they didn't take the time to recover adequately, right? They didn't take the time, they went hard every single day, and there was no time for recovery. And that tendon said, screw you, I'm not doing this anymore, and it ripped. The other thing could be is that they progressed too quickly. So it's similar to not having enough recovery, but your muscles are going to build stronger than your tendon, stronger than other structures are able to adapt. And so if your training protocol is always 3 sets of 10, 3 sets of 10, 3 sets of 10, and you're not doing any like higher volume, more time under tension work at lower loads, you're not giving the tendons enough time to catch up. And this is really important that if you're doing this by yourself or you're working with a trainer or whatever, that they understand how your biology works. ultimately it's all biology. It's all biology is what's going to cause these problems and stop them from healing. If you can get things correct and set things up in the right environment, right? And now we're just talking about biology, not the other things that are just as important, and we'll talk about that. But talking about biology, the load to the tissue exceeds the tissue's capacity to handle it, you're going to be injured. And it's the same with rehab. And if you're not putting the right stimulus in, you're not going to get better. So we're going to roll right into why treatment fails. Okay, so we talked about some of the diagnoses, and they're each unique. Now, why would treatment fail? Maybe somebody gave you or has the wrong diagnosis for you, right? So that's like putting the wrong destination in your GPS. You're not going to get there, right? So if you have the wrong diagnosis, you end up doing the wrong treatment. It's not going to fix it. Why else would it fail? You could have the right diagnosis, but the wrong treatment. So going back to like a GPS type of analogy, that's like you have the right address in the GPS, but you decide to wing it and you don't ever end up there, right? Like, I mean, no one knows how to get any place 5 streets over anymore. So, you know, if you know what's going on, you need to have the right treatment for it. So some of what this might look is that you or your provider is treating a symptom and not the actual root cause, right? So it's like putting out a fire in one side of the house, you know, but you didn't get the rest of it. And so the fire keeps spreading and you're only looking at one spot and you're missing the fire over here. The other thing is that it could include the wrong dosage of treatment as well. So either you're progressing too slowly or you're progressing too quickly. And that happens, and it's human nature. It's like, this is working, so like, I'm going to do more of it. And that's not always better. More is not always better, and you don't always need to change it. But our human nature is like, okay, this works. Like, let me try something different instead of just sticking to it, right? Now, the last part of it, so wrong treatment, right diagnosis, is you go and see someone and they just give you a cookie cutter type of exercises that don't look anything like the things that you want to actually be doing. You know, you're a throwing athlete. It's important for you to be able to throw. This is where you get the pain, but they tell you to do these down here and they never get you into overhead positions, right? You want to be able to press a bar overhead, but none of your rehab looks like this. It looks down here, it looks like pulling down here, but they don't put you in these positions here where you want to press. So, or, you know, you want to be able to put things on the top shelf in your kitchen and nothing looks like you putting something in the top shelf of your kitchen. So it's the right diagnosis, it's the wrong treatment. The last part of this is that the treatment stops too soon. And there's a lot of reasons why this happened and happens. And, you know, I talked to you about my experience working at a place where I had to see 30 patients a day and I could never really build a therapeutic alliance and trust with my patients because I had so many at the same time. Like, it just was not humanly possible for me to give everything that I wanted to. And so as the end user, as you, as the client, as the patient, like, if you don't feel that connection, if you don't think that I know what's important to you, you're going to say, fuck this, I'm not doing this anymore. Like, they don't get me. They're giving me exercises down here that don't seem to make sense. He doesn't even know that, you know, I'm trying to be a pitcher. Like, you're going to stop, right? Like, I mean, you just are. It's so important to make sure that there is a relationship there, right? The other thing that happens is that the expectations are not set. So you've had shoulder pain for 4 years and you know, and truthfully, like, it's going to take 6 months to get you to where you want to be, but they say, oh yeah, we'll have this fixed in a month, right? And so at the end of the month, you're like, why isn't it better? And then you stop. But really, the wrong expectations were set from the beginning, or they didn't tell you, hey, you know what? If you want to get better in a month, you need to be coming in here 5 days a week. You want to be like an athlete, you got to come and rehab like an athlete. And so those expectations aren't set. And so you stop doing it. You stop too soon because you think that the guy doesn't know what they're talking about. They might have been doing everything right, but just told you the wrong time frame for what it would take to actually get you better. The other thing is that you lose motivation or lose focus, and a lot of this too has to do with this therapeutic alliance and being on board and knowing what the expectations are for you to actually get better. Let me see if I missed anything else here. Yeah, I mean, ultimately what happens is that you stop too soon for the end result, for what you really wanted to get back to doing to happen. And the sad thing about this is that most people won't then go and find somebody else to fix this problem, or at least not like right off the tail end of this bad experience. They'll be like, oh, well, that just doesn't work for me. And, you know, it's more complicated than that. And there's a lot of different providers out there that are really good and that will understand that. And full circle here, this is where like my sociology background comes into play, because I was very uniquely, when someone pointed this out to me, and truthfully, this wasn't in PT school. They didn't talk about this sort of stuff in PT school. PT school was all about, you know, become the best at this, you know, at this technique. You're going to be the best at this technique. But it missed that human connection component, which is too bad. And then you get thrown into this world where it's like, yeah, you know, you're going to see 30 patients a day, or you're seeing 3 an hour. And you're like, I don't know. It sucked. It sucked, and I hated it. But anyways, there has to be that connection there. And this background that I've had has allowed me to build this business in a way where we really can put our clients at the forefront. So those are all the reasons why it failed. And so what you need to do, and really what this is about, and what I'm hoping that you're getting from this, is that the shoulder is a very, very, very unique and complicated joint. And that if you're just trying to do quick fixes for this, or Google something, or look at exercises on YouTube, it more than likely is going to miss the mark. And the thing that you know bothers me the most, or I shouldn't say bother me, that makes me sad the most, or affects me the most, is that it's going to make you stop doing things that make you uniquely you and that bring you joy in your life. And you know, and besides like the money cost, I mean, there's more of a time cost when it comes to the value, and you being able to be the best version of yourself and feel independent and able to do the things that you want to do, because it's more than just being able to lift a weight. It's that feeling of having the ability and the options to do these things. So, you know, people with the best life are always going to have the most choices. And so why limit yourself with all those choices? You know, find someone that's going to be able, that understands the shoulder, but is going to understand you as a person and wants you to really succeed. All right, so I've got some questions here. And if you didn't get to the survey and you want to throw a question in the chat, go for it. I'm going to remind you again that in the chat, we did put in the link to sign up for the consultation, for the complimentary consultation, in order to take $100 off of a full evaluation, head to toe type of thing, get to the real root cause. So if you want to click on that and sign up, go for it. But I'm going to do this Q&A right now. I had a question from Raylyn on thoughts on surgery to remove inflammation. So surgery is like a hugely traumatic event. So surgery is going to cause inflammation. I'm not sure if I'm like missed something on this for this question, but surgery is traumatic. It is an injury. You're having somebody go in there with like literally tools and cut and saw you and hammer you. So, and truthfully, like what they're going to put in there, the design is never going to be better than like our intelligent design that we have, and you have a risk of infection. So if you can avoid it, please do. Now, other PT exercises to help reduce pain, yeah, that goes along with the, like, not going to be able to do this. But if you are just looking for like, you know, some exercises to do, and you're okay with seeing what works and what doesn't, you can check out our Instagram. We've got tons of shoulder stuff in there. And we even have like, now they let you like put together different like types of posts into one thing. So if you look through there, we have one on the shoulder. So here it says, does posture play a role in shoulder pain? So this is a great question. This came up a couple times actually. Posture will play a role in shoulder pain. And I'm just going to give you a quick example of it. But I talked to you about thoracic extension and that last 15 degrees. So if I do this differently, and here I am in this, I work from home, or I sit at a desk all day with crappy posture, and I can't extend here, but now I want to go and do a bunch of pull-ups. So my posture's here. I can't open up. I don't have extension motion, and I'm trying to get overhead to do pull-ups. Like I'm going to hurt myself here. So yeah, posture 100% is going to play a role. Sleeping on your side, yeah, that can cause pain, definitely. But if we look at it from the perspective of that recovery time, if your shoulder is not already so close to red line, right, meaning that it's irritated from other things, you should be able to sleep on your side without pain. What are unconscious movements or ways of sitting we may be doing that would cause this pain? So the posture itself is not this by itself is not usually the pain generating thing, but it's when, okay, now I need to cook, or now I need to get something from the shelf that really causes pain. So, so really what you want to do is you want to move more. And it doesn't really matter what, but just don't get stuck in one position for too long. Tyler wanted to know about improving aberrant capsule space. Yeah, so there's different types of stretches that you can do. Some of the FRC pails and rail stuff that I like for improving more mobility, but if you're talking about really getting more capsule space, those are long and extended holds of stretches. Maria wants to know, will the pain stop? And I will tell you, I hope so. And I hope that after hearing this, you're one step closer to being able to figure out what the next step should be for you. And also, truthfully, on that survey, there's a lot of people that said that they've started physiotherapy or PT, and I think that's great. But I hope that you are ending up with, or at least things that we talked about here, and the things that I'm telling you are going to be blocks for somebody being able to get better, that you're not falling in that trap. They're not just giving you cookie cutter exercises. They're not just having you, the exercises don't look anything like what you actually want to do. Terry says, does heat or ice work better during a flare-up or after exercise? Terry, we don't like ice here. Typically I don't have people ice. Typically people don't like ice, and what it's going to do is it's going to, ice will help with some of the symptoms. So if you have some pain, it's going to numb the pain, but it doesn't fix anything. It doesn't solve anything. And it also slows down blood flow to an area, or to the area that you've iced. So if you want to get more blood flow, and healing requires blood to get to it, you could try heat. And if heat feels good, try heat. Neither of those, passive treatments in general, meaning electrical stimulation, ultrasound, ice, heat, passive modalities are never really going to fix the problem. There needs to be something active, unless all you want to be able to do in your life is just sit and not move. Sujita asks, how to relax the shoulders, roll back down, and strengthening exercises. Any tips to reduce the hunch? So you want to work on thoracic spine mobility, as well as, yeah, like you said, some strength of the lower traps. You can find those exercises on our Instagram. Right, let me see if we got any other questions here. Link is not working, Eric. You want to try again? Oh, copy and paste it into the URL. Okay. Thanks, Nico. No, I think it works. Okay. Marilla, if the shoulder pain subsided significantly after resting for a few days, does that mean that it could have been a temporary issue, or is it possible that there is an underlying issue? Also, I have always had posture issues. Could that be causing the pain during my workouts? Okay, these are great questions. So if the pain subsided after doing it, yeah, if you really just strained your muscle, rest would help it, right? As long as you didn't tear your rotator cuff, or there isn't something better. So that might mean you just did something that caused some short-term injury, and it had nothing to do with, poor scapular mobility or some underlying root cause. That happens. But often there is a reason that happened, and it could just be that your training intensity was higher than you can tolerate, and the fix would just be okay, you just need to tone down what you're doing. Most people though can benefit from having a professional look at them and look at how they're moving, especially if it's yeah, I'm going to spend 5 5 hours out of my week exercising. So like, obviously it's valuable for you to move the best you can. They would benefit from having a professional look at them and see how they're moving. I mean, it's the equivalent. I hate using this analogy because it's not quite so simple, but like, if you drive all the time, like you got to bring your car in for a checkup to make sure that like the hoses haven't dried out and that you've got windshield wiper fluid and that the tires don't need rotating. Like, we need that too. Also, I've always had bad posture. Posture 100%. And when we talk about posture, that's a static posture, just like how you're standing. So static posture, but your actual overall mobility will affect how you move and can contribute to injury. Sometimes you hear popping when rotating. So the popping when you're rotating your shoulders doesn't necessarily mean it's impingement. And if it doesn't hurt, I wouldn't worry about it too much. All right. Anybody else have any questions? Raylan, she could only treat the diagnosis, not the actual cause of pain, so it's really hard to know how to treat it. Hope that makes sense. Yeah, Raylan. So, yeah, it's a funny thing. It doesn't make any sense that she couldn't get to the root cause because of insurance stuff. It's like, I don't know. I mean, there's a whole other tangent, but yeah, it's hard to know how to treat it if you don't know what's causing the root cause. So I'd say find somebody, if it's not that can get to the root cause so that you can actually go in the right direction. So you don't end up, over here when you needed to get here. And if you don't know where you need to go, how are you going to get there? Carrie said, is the kind of pain, how the pain feels, an indicator of whether there's a problem with your muscle, tendon, nerve, or inflammatory tissue? How the pain feels, yeah, sometimes. So like a nerve thing would be like tingly or electricity. Sometimes it presents in the dermatomes or the myotomes. So there's like different patterns that the nerve would show up in. When it comes to like tendon versus muscle, not always. Sometimes there's some patterns that you'll see, but it can change a little bit. But there are patterns, I would say. That's more of the thing. But again, that's just really going to talk to more of the source of the pain and not like why this thing is happening. Okay, all right. Okay, all right. Okay, does anybody else have any questions? That's all I've got for today, and I want to thank you all for coming and listening to my spiel. I hope that you feel like at least you have more clarity on what could be done, and if you have tried doing something before and it didn't work, you understand why that didn't work and you know what to look for next. The shoulder's complicated, so get a professional to look at it if time is of the essence and of value to you. Thank you so much, and I'm so glad to be here. Happy Saturday, everyone from all over the world, and enjoy the rest of it.